Okay, this video is why are nurse practitioners and physician assistants replacing MDs? Okay, and here's what it comes down to. Big Pharma runs the show. They run the medical system. They got billions of dollars, and they're going to get their money no matter what. Any design of the medical system is not going to happen unless Big Pharma approves it. The country's going broke. Conventional healthcare is becoming too expensive. The golden age of medical money when doctors made lots of money back in the 1980s, that is long over. Okay? People didn't like HMO. Something new had to be done. How can Big Pharma still maintain its profits? Well, there's a lot of things they could do. They could promote phony, closet, you-know-whats, like Jordan Peterson to say people need to take more psychiatric medicines. Okay, by the way, he's a big phony, all right? Okay, number two, they can promote phony, lousy doctors that are fakes and have them promote high-fat, high-protein diets that will keep the public fat and sick. Check. That's done. Okay, can buy the journals and the scientists to control what gets published in the medical literature? Check. Can structure the medical education system so that doctors are only trained in drugs and surgery? Check. Doctors just learn, look at college, what a joke. They learn calculus and physics. That has nothing to do with medicine. It's a fake education, okay? They don't learn anything about nutrition and toxicology and epidemiology, the things most relevant to understanding disease. Okay. They can structure the medical billing codes so that doctors only get paid well for the most part if they prescribe a lot of drugs. Check. They can do a lot of bogus studies that exaggerate the benefit of drugs. Check. They can do a lot of bogus studies that lower the threshold to treat common diseases. If you treat cholesterol at a lower level and hypertension at a lower pressure, you sell a lot more drugs. They can market over-the-counter meds directly to patients. Check. They can market prescription drugs to patients. Check. They can lie about the so-called benefits of psychiatric medications and, give them to kids and make the kids sicker. Check. But that's still not enough money for Big Pharma. What else could they do? Well, they've got drug dealers on every corner. They need cheaper drug dealers. They can replace the MDs and DOs with NPs and PAs. Check. That way Big Pharma still gets their money, but the provider is paid less. Okay, what's next? They're going to replace them all with artificial intelligence. Just send the patient to a kiosk, have them type in their symptoms, and AI, which of course is scientifically written by Big Pharma, will prescribe the newest drug that's still patented based on science.